publicly announced, and all of that is an effort to make sure that we address these matters in the fairest way that we can during this extraordinary period. Iolo, diolch yn fawr, ac yn ola heddi, last today to Tom Magna at Carers World.
Thank you very much indeed, First Minister. You've referred at various stages today to balances of harm. Against the background of the NHS experience as reported earlier by ITN, can I ask you to look specifically at the balance of healthcare harm, where doctors make life and death medical decisions, say, for example, to treat a COVID-19 patient, whatever their state of health, ahead of a seriously ill non-COVID-19 patient? Doesn't maintaining the Christmas relaxation, albeit modified, as well as the continuing effect of the pre-pandemic funding pressure on the NHS in Wales, tip the balance of healthcare harm, no matter what you may wish for, realistically towards treating only COVID-19 patients at the expense of treating seriously ill non-COVID-19 patients? Whether yes or no, I'd be interested in your reasoning.
Well, it is precisely in order to avoid getting to that position that we are making the decisions we have today. If we are not prepared to take the actions that are needed, and if we can't persuade people in Wales of the need to do so, then we will end up in the position that you have described. That is how serious things are. We have to balance even that against other harms, as well as the letters that I have read from people explaining just how important it will be for them, for their mental health, to be able to meet some other people over Christmas. I read letters from informal carers as well, telling me that their ability to go on providing the service that they do day in, day out depends upon them getting a little bit of extra help over Christmas from other members of their wider family. So these are all impossible balances to try to strike. It is why we continue to allow some modest additional freedoms over those 5 days, balanced against the actions we then need to take to prevent the health service having to make the sort of decisions, Tom, that you referred to.
You referred to unpaid carers. There, of course, the health and survival of two people stands to be at risk, rather than just simply one, because of the carer and the person they care for. Shouldn't that tip the balance of harm in those cases back towards treating seriously ill non-COVID patients in the home unpaid caring context in place of some COVID-19 patients? A difficult decision, but isn't that one that should be a factor?
Well, Tom, all I can say again is that our aim is not to have to make those choices. We're not making those choices in the NHS today. I said earlier on that we had 98 patients suffering from coronavirus in critical care. We have more than that number in critical care for other reasons. So we haven't reached the point, and I don't want us to reach the point where doctors are having to make those incredibly invidious decisions. Unless we take action, that is where we would end up. It's why we have made the decision, why we've made it public today, why we need to ask people in Wales to make this extraordinary effort, even at a time of year when in all other circumstances, people would be looking for greater freedom in their lives, rather than facing having to go into a period where things are going to be tougher still. Tougher for carers, tougher for people living on their own, tougher for businesses, tougher in our public services. None of those decisions can be made lightly, but they are being made expressly in order to prevent our health service having to choose between people who they can treat and people who they can't treat, both of whom have serious need to be there. Thank you all very much indeed. Diolch yn fawr.
Thank you very much, everyone.
Yes, thanks.
Thank you. See you Friday.